Hello, my name is Esmeralda Painter, and I am a graduate student at the University of Alabama. This is a video presentation on the breastfeeding effects on children for NHM 509 Research Methods in Nutrition. We will review two peer-reviewed articles on this topic. The nutrition problem. Children who are not breastfed are at an increased risk for developing diseases and/or other illnesses. Only 4 out of 10 babies are exclusively breastfed. According to the World Health Organization, around 45% of deaths among children under age 5 years are linked to undernutrition. These mostly occur in low and middle income countries, and at the same time, in these same countries, rates of childhood overweight and obesity are rising. According to the Convention on the Rights of the Child, every infant and children has the right to appropriate nutrition. Breastfeeding is one of the most important factors for the health, development, and survival of a child. And the research question is this: does breastfeeding reduce the risk of development of diseases in children? The articles that we are going to review for this video is Breastfeeding and Diseases Prevalent in the First 2 Years of a Child's Life, a cross-sectional study, and Breastfeeding and Impact on Childhood Hospital Admissions, a nationwide birth cohort in South Korea. We will begin reviewing the first article. The overall conclusion of this article showed that the study results demonstrated that children who did not breastfeed had a higher prevalence of disease than those children who were breastfed. The population that was studied was 2 hospitals in the city of Maringá, PR, southern Brazil. The study population consisted of 401 children who were born with a gestational age of greater than or equal to 37 weeks. The results are limited since it is a small sample size and only of Brazilian children. This study also excluded children who were born less than 37 weeks of gestational age and/or had any other illnesses or diseases at the time of birth. We will move on to the methods section of this article. So this article was a retrospective cross-sectional study with matrix research carried out in 2 hospitals in southern Brazil. Strobe guidelines were used. Data was collected from March to October 2020 by consulting the electronic health medical records of children. The primary outcome variable under investigation was the presence of prevalent childhood diseases in the first 2 years of life and their association with exclusive breastfeeding, identified from the diagnosis recorded by the doctor in the medical record. So, retrospective historic methods of doing a study includes identifying the population prior to developing the disease or outcome, then collecting health information and exposure incidences collected in the past. The medical records were assessed for the presence of certain international classification of diseases codes. So here's a list of all of the codes that were looked for in the medical health records of these children. So the presence of diseases was considered when the children presented at least one episode of these diseases. So we have acute infections, cough, otitis, fever, diarrhea, gastroenteritis, abdominal and pelvic pain, functional bowel disorder, gastroesophageal reflux, urinary tract disorder, and diaper dermatitis. We will now go over the analysis of this article. So biravid analysis between the independent variables with the outcome variable prevalent diseases in the first 2 years of life. The Kolmogorov-Smirnov test was used to test data normality. For both analysis, a 5% significance level was adopted in Wald's chi-square test, and a p-value and 95% confidence interval were presented. A bivariate analysis helps identify trends and patterns. It can reveal hidden data trends and patterns by evaluating the relationship between 2 variables. It is one of the statistical analyses where 2 variables are observed. One variable here is dependent while the other is independent. Limitation of this article is that the data is secondary data. This has limited the reliability of the information obtained. Also, childcare consultations performed by nurses were not assessed in this study because in these, the focus is on nursing diagnoses and intervention guidelines. So if there were issues with a child that was handled by a nurse, then it would not be included in this data. Data was already collected, so researcher is limited to what is already available. Also, it is a specific location to Brazil. It does not include any other locations. And again, this is a small sample size with only 401 children. And the results for this article were that there was a higher frequency of illnesses in children without exclusive breastfeeding at 6 months. And it was also observed that the absence of only one episode of prevalent diseases is statistically associated with a higher frequency of exclusive breastfeeding. And the proportion of children with exclusive breastfeeding affected by some prevalent childhood disease was significantly lower. In conclusion, regardless of any other variable analyzed, children who were not exclusively breastfed until 6 months and did not maintain breastfeeding until 12 months had a higher prevalence of diseases in relation to breastfed women. Now we will review the second article. This article takes place in South Korea. It's a nationwide birth cohort. The overall conclusion of this study was that the evidence provided was 6 months was associated with a lower risk of subsequent hospital admission, and this lower risk was particularly pronounced for exclusive breastfeeding. And the population studied were Koreans. It's a nationwide birth cohort study, and it consisted of studying within this time frame, 1st of January 2009 to the 31st of December 2015. And further research could be done in other countries. The methods for this article were a birth cohort with data set of all infants born between 1 January 2009 and 31 December 2015. And they had to have had records of receiving the first National Health Screening Program for infants and children. The primary outcome was the incidence rate of any hospital admission during the observational period. Now, for the statistical analysis of this article was a negative binomial regression model that was performed with incidence rate ratios and a 95% confidence interval. The strength of this article was that this is the largest analysis to evaluate the protective breastfeeding effects of subsequent hospital admissions, and it is the first to focus on the lag time effect of subsequent hospital admission. The large representative sample is of 1.61 million children. The limitation of this article is that data is reported by parents, which can lead to misclassification due to recall bias. There is also a single point examination, which can lead to an overestimate of breastfeeding than average and a longer period of recall bias. And again, this is a specific location of South Korea. But again, also the sample size is large. Millions of people were studied. Now, the results for this article were that when compared to children with fully formula feeding, the hospitalization rate was 12% lower in those with partial breastfeeding and 50% lower in those with exclusive breastfeeding. In this Korean nationwide birth cohort study, breastfeeding for at least 6 months was associated with a lower risk for subsequent hospital admissions. In conclusion, it was concluded that regardless of any other variable analyzed, children who were not exclusively breastfed until 6 months and did not maintain breastfeeding until 12 months had a higher prevalence of diseases in relation to breastfed children. And here are my references.